We're at my favorite shop, the CG Company, Cannabis Good Company, here in Albuquerque, New Mexico, with my favorite prescriber, Anita Briscoe. So, Anita, tell us a little bit about yourself.
I'm a native New Mexican. I was born and raised here, and I have been a nurse for 40 years. I have been a psychiatric nurse for 25 years, and I have been a nurse practitioner for 14 years. 9 of those 14 years I've been referring people into the medical cannabis program.
Wonderful, wonderful. So, why did you decide to progress into the cannabis field?
I'm seeing over the years of my psychiatric practice that cannabis is helping more of the mental illness that I see than any other medication. And the psychiatric medications have really horrible side effects, such as obesity and heart attacks and
Absolutely.
cataracts. And cannabis is a natural plant. We co-evolved with this plant. We were meant to have this plant. And I've seen over and over again how my patients who mainly have been traumatized are able to pretty much heal with cannabis.
Wonderful.
So I changed over from prescribing pills to cannabis.
Wonderful. One of the big things that you're kind of known for these days, you've done a few different articles in magazines, and you've done interviews all across the country regarding opioid addiction and cannabis's use to help treat opioid addiction. What are you finding out about that? Why did you push for the opioid addiction to be considered as a qualifying condition here in the state of New Mexico?
Over the 9 years that I have treated people with mainly PTSD, they have to come back to me every year to recertify, right? So they come to me the first year with horrible PTSD symptoms, and then over that year, while they're on cannabis, those symptoms clear. And then they come back to recertify, and they say, oh, by the way, I was able to quit heroin. I was able to quit my pain pills. I was able to completely go off my pain pills or completely go down on the dose.
Wow.
So this happened enough times that I started to see a pattern, and it was pretty striking, and I started reaching out to my colleagues and asking them, are you seeing the same thing? And I reached out to 3 colleagues here in Albuquerque, so that would make 4 of us, and each of us said we have approximately 100 patients in our caseloads each that we are seeing this, so that we have a sample size of 400. And that is very statistically significant.
Gotcha.
For a study.
Right.
And I also gathered the help of these 4 colleagues because I said I'm writing a petition next time for the Department of Health to include opiate dependence as a qualifying condition for medical cannabis. And if this were to pass, we would be the very first state to do this. Unfortunately, it didn't get approved by the Secretary of Health and the governor, but the state board of the Cannabis Medical Advisory Board did approve it.
Wonderful. So, why would you say, or in your opinion, did the Secretary of Health and Governor not approve?
Because there are 3 lobbies in this state. There's the private prison lobby, there's the alcohol lobby, and there's the big pharma lobby, who I think greatly influence our politicians in this state, and they all 3 are very against legal cannabis, recreational cannabis, and cannabis for opioid addiction.
For many different reasons, I'm sure. I mean, even beyond the opioid addiction, I mean, cannabis is such great medicine. It can be used in so many different ways that can really help to take money out of those 3 big lobbies.
Definitely,
Yes.
definitely.
Yes.
Yeah, and ostensibly the Secretary of Health, when I met with her in person, said that she wanted empirical evidence, and she wanted hard, clinical trial studies in front of her before she would approve it, and we'll talk about that later.
All right, sounds good. Sounds good. So, what are some of the indicators or signals that people can actually look for in their loved ones or even within themselves to know that they are becoming or have become addicted to opiates and opioids?
Well, there's stages to addiction. The first stage is called tolerance, and so say in the example of my patient who has been on the news and KOAT has filmed him, and he's a really good example of what goes on in New Mexico. he had a sports injury in high school, and they put him on Percocet, which is oxycodone, and he took his bottle of Percocet and started needing more Percocet to achieve the same effect.
Right.
So that is called tolerance. So the way our brain receptors work, tolerance can happen very quickly with opioids because the receptors start to go away, and you need more and more of the drug to achieve pain relief. In the case where people do opioids recreationally, for that euphoric effect, you need more and more and more to get the euphoric effect.
Gotcha.
Therefore, my friend was cut off by his physician, no more Percocet. So by then he was fully addicted, and craving is the next step. And he was horribly craving opiates. And when you're in the craving stage, it's all you think about. You think about it day and night. Where can I get it? What do I have to do to get it? Who do I have to rob to get it? Or where can I get the money? So he was in the craving stage, and he didn't get in trouble in order to get heroin, but he did get a hold of heroin, and he snorted it. I don't believe he ever injected, but that's when he was addicted to heroin.
Wow.
So the next stage is withdrawal, where you get the withdrawal symptoms from opiates, which are extraordinarily miserable.
Right.
You sweat, you ache all over because the pain isn't being treated anymore with the opiate. It's not being addressed. Your blood pressure goes way up. Your nose runs. You have nausea. You have vomiting. You have diarrhea. It's just absolutely miserable.
Yeah.
And you will do anything to avoid withdrawal symptoms.
Of course.
So those are the stages of addiction.
Okay. And so, with those being the stages of addiction, how does cannabis help one to alleviate these symptoms?
It starts where the addiction starts. It starts at the tolerance stage.
Okay.
So you don't need as many pain pills, for instance, if you can supplement them with cannabis. And research has just been published that cannabis does what is called potentiates opiates. So it boosts their activity in the brain where you don't need as many opiates. So they work hand in hand.
Okay.
And so at the very beginning, at the very outset, you need less opiates to treat that pain if you use cannabis with it.
Yeah.
Primarily THC combined with CBD
Okay.
is the best.
Okay.
So at the tolerance stage it works, okay. At the craving stage it works because my patients have been smoking cannabis rather than during a craving period they've been smoking cannabis. It's been able to get them through that craving.
Right. And does it help to kind of distract the mind a bit as well?
It does.
Okay.
It gives the euphoric effect that you get with opiates
Gotcha.
as well. And then alleviates withdrawal symptoms. And there's a clinic in California, and I'm going to be speaking at the Capitol next week with this gentleman, and he is actually using cannabis in his clinic to get people off of heroin.
Wonderful.
Clinics are starting to sprout up all over the country.
Yes. Yes.
So it helps with all stages of opiate addiction.
Wonderful, wonderful. And you mentioned that there are clinics popping up all across
All
the
over
country.
the country.
That's great.
There are so many studies that have been handed to the federal government because they need funding, of course.
Right.
And they won't fund these studies because it's illegal at the federal level. It's listed on Schedule 1,
Gotcha.
which means it's listed up there with LSD, which means it has it causes great harm and has no medical benefits.
Right.
So as at the federal level it's listed as that. Therefore, the government will not allow or will not fund very sophisticated studies such as clinical trials. It has to sit on the desks of 5 federal agencies before they'll even consider the research, and that can take years, if not decades.
Right.
And the more rigorous types of clinical trials are not allowed to be done. So there's several other types of studies that are being funded at the state and local levels. For instance, Colorado is using its millions of dollars to fund a lot of research.
Okay.
but I'm not aware of the federal government allowing research just yet.
Okay, okay. And so, given your stance on cannabis being used to help to treat opioid addiction, what do you think about the notion of cannabis being a gateway drug?
Cannabis is a gateway out. It's my next petition, if I have the energy to do this, is alcohol dependence.
Right.
My patients have been able to quit drinking
Wonderful.
because of cannabis.
Wonderful.
It's a way out.
Excellent.
It does not cause people to use harder drugs. It's a really nonsense term that was invented in the 70s.
Right.
I would throw in a caveat there is that cannabis is not good for the growing mind.
Right.
Teenagers who are maybe starting to experiment with it should be discouraged because it does mess with the dopamine system in the brain. And it messes with the learning system and the memory and retention systems. Right. And it can cause people to be lazy and lay on the couch and have couch lock. And teenagers really shouldn't be using it because their frontal lobe has not developed. And it does inhibit the development of the frontal lobe. And that's the lobe that makes us make wise decisions,
Right.
not do stupid things, have really good judgment and really good morals and abstract thinking. So our brains, our frontal lobes are not developed until about the age of 22.
Wow. Okay.
So kids between that age of, say, 15 and 22 should not be using cannabis.
All right. That's very good to know as well.
Mm-hmm.
Great knowledge for everyone there. So in what other ways do you feel cannabis can be used medically that isn't currently recognized by the state of New Mexico?
Well, it's showing very promising results in Alzheimer's. It's able to inhibit plaque formation in the brain. Those are the hard little things that form in the brain when there's Alzheimer's. It inhibits plaque formation in the brain, so it's preventing Alzheimer's.
Oh.
We just had a petition to approve it for Alzheimer's, and she refused to sign it as well.
Okay.
There's a study in Spain going on that if you put cannabis directly into a brain tumor that's called a glioblastoma, which is what Senator McCain has now, it shrinks the tumor and makes it go away.
Wow.
It's curing glioblastomas.
Amazing.
It is shrinking breast cancer tumors.
Wow.
It is helping with dementia. They're using it in Israel in nursing homes with demented patients to help manage their behavior.
Right.
It's helping with violence. It's helping with the violent behavior of autism. A lot of my patients with ADHD come to me and they say that sativa helps them to focus and it helps with their ADHD symptoms. I see new research coming out every single day on what cannabis is doing.
Exactly.
Yeah.
And so right now we are just sitting on 20, is it 20 or 21 approved conditions here in the state of New Mexico?
We're at 21.
And so, I mean, with your account there, that could bring us up to 25, potentially even closer to 30, and it's just ever expanding. So
Ever expanding.
that would be amazing if we're able to see it progress here within our state, and maybe even be on the front lines of the, taking care of the opioid addiction. Be one of the trailblazing states. That would be amazing. So, are there any final words that you'd like to tell the world about cannabis or about you or?
My wish for New Mexico, since we are really, really down in the dumps right now, as far as poverty and crime, and we're the worst place to raise a kid, we're the highest crime state, there is one way out of this, and it's cannabis. We could be the leader in cannabis research. We could be the most innovative state because we do have one of the highest opiate addiction rates in the whole country, if not the planet. We could research that and bring that down, and we could start being a mecca for cannabis research. We could also start being a mecca for hemp.
Right.
Because a lot of CBD comes from hemp, and it's good. It's better if it comes from cannabis.
Right.
But we need to start growing hemp.
Absolutely.
That's something that may actually happen.
Wonderful. There were just some reversals of judgments,
Yes,
right, based on
yes,
the
the
vetoes.
governors, yes.
Yeah.
And then the other dream I have is for New Mexicans to start growing their own. I love dispensaries, but my dream is for New Mexicans to start really, really learning about the strains that help them and cultivating those strains and getting into the science of growing those strains
Right.
and having their own medicine in their backyard.
Absolutely, absolutely. That would be great.
That's my dream.
All right, and I'd say that's a great dream. So, Anita, I want to thank you so much for joining us here at info.thc.
Aw,
All right, and we
Thank
hope to
you.
see you again sometime soon. Oh,
Definitely.
and I know you're semi-retired.
oh, I'm around.
All right, well,
I'm
in that case,
available.
I'll let you know if we need you
Totally
again.
available.
All right.
Okay.
Sounds great, Anita.
Good.
Thank you so much.